Karen Shirley. I'm the Program Director for Surgical Technology here at Carrington College, California. And we train people to become surgical technologists, and those are the people who assist in surgery with sterility, passing instruments, preparing supplies, and just keeping the OR sterile and ready for whatever the surgeon needs. We have the patient's lives in our hands, and we are critical to the operating room. So with that in mind, we have some very strict rules for sterility and staying sterile and all of the things that we have to do to accomplish that. So we practice that here in the lab with the students. We teach them what those techniques are, how to practice them, and what to do in case they make a mistake. So we're very strict, and we follow all of those rules, and we have them practice over and over and over to be sure that they're getting it done correctly. In addition, we work on instruments. We have to know the names, how they're passed, what they're used for, where they're used, and how to handle them. So this group behind me is practicing on that now, so let's go ahead and take a look at what they're doing. One of the roles of the surgical technologist is to assist the surgeon by getting on his gown and gloves. Go ahead and get that started. So the first thing we'll do is hand him the towel so he can dry his hands. And again, just like with everything we do in the operating room, there's a certain technique for doing this so that we can maintain sterility, which means there are no bacteria or germs introduced to the patient. So while the surgeon could do this himself, it's easier and there's less potential for contamination if the surgical tech helps him out with that. Now she's going to get his gloves and help him get those on, again in a sterile manner. And she knows the size of his gloves because we have a preference card that lists everything that the surgeon likes. So that's how she knows what she's doing here and what he'll need for the rest of this case. One of the other things that we do in surgical technology is help the surgeon drape the patient. This provides a barrier to the surgery so that there's a sterile area where patients can be protected from the germs and contaminants that are in the air. By doing this, it also provides an area where we can work that protects the patient from any blood or body fluids that might be released during surgery, so it protects the patient, the drapes, and the personnel in the room. This is just one of the many roles that surgical technologists perform in the operating room that we teach and students practice on a daily basis.